Good afternoon, everyone. On behalf of the organizing committee of the Rethinking Everything COVID-19 in the Americas and our partner institutions of the conference, the HF Global Public Health at the University of Miami, the Institute for Advanced Studies for the Americas at the University of Miami, and the International Association of Providers of AIDS Care, we welcome you to this panel, LGBTQ Activism During the Pandemic. It's my honor to introduce you the moderator for our panel, Erika Castellanos. Erika, originally from Belize, a transgender woman living with HIV, Erika is the director of programs at Global Action for Trans Equality and currently the alternate board member to the board of the Global Fund for the Communities Delegation. Erika, I turn the cameras to you.
Thank you very much, Ariel, and I want to join you in welcoming our viewers in this session that we'll be discussing about LGBT activism during the pandemic. So this year has been very challenging for us, but we're going to discuss those challenges and the issues that LGBT communities have faced. And for this discussion, we have an amazing panel. And just allow me to introduce them to you. We will be joined by Simon, who is the president founder of Somos Gay Paraguay and general secretary of the Latin America Gay Latino Network. We will also have Elsa. Elsa is a research associate at the Center for Health and Society Studies at El Colegio de Sonora since 1999, where she has collaborated on research action projects on issues related to gender and health, sexual and reproductive health, HIV, and chronic disease prevention. Joining us also is Mohan. Dr. Mohan is a trained physician from India with a Master of Public Health degree from Harvard University. As a policy and programs expert, Mohan has a footprint in global advocacy and local grassroots community development in over 20 countries. From the Caribbean, we're joined by Kenita. Kenita is the founder and executive director of the Eastern Caribbean Alliance for Diversity and Equality. ICADE is an independent umbrella organization inclusive of organizations operating in the small islands in the Eastern Caribbean, from the Virgin Islands to Grenada. Kenita has advocated around HIV and human rights inclusive of women, youth, and LGBTI issues for over 15 years and climate change. And our final panelist is Alessia. Alessia is the president of Fundación Iguales, the largest LGBT advocacy organization in Chile. Before joining Iguales in this capacity, Alessia spent most of her professional career working in the private sector as an industrial engineer. And it was precisely during this time when she became the first transgender woman to publicly transition at a major Chilean corporation. So welcome to all the panelists, and I hope our viewers will enjoy this discussion as much as I'm enjoying being amidst such excellent activists from all over the region. So just to begin the conversations, I would like to ask our panelists to please share with us how has the COVID-19 pandemic affected LGBTI activism in your country, in your region, and how has it affected your work? Perhaps we start with Mohan.
Thanks, Erica. I think I'll share your enthusiasm in joining this really amazing esteemed panel, and it's really great to see some familiar faces, including Simone. And thanks for inviting me for this panel. I think it's hard to talk about how COVID-19 has impacted LGBT activism without talking about how COVID-19 has impacted LGBTI people, more generally speaking. And I think we all know that COVID-19 has a social shape just like HIV does, in that COVID-19 has taken a toll on brown and Black communities, especially here in the US. It's also taken a toll on access to health services for LGBTI communities. It has also impacted health systems from delivering services to LGBTI people, in that services for LGBTI people have been deprioritized. There's certainly been an uptick in levels of stigma and discrimination against LGBTI people. There's more room for domestic violence and abuse, especially as LGBTI communities travel and navigate lockdowns. And then finally, I think the pandemic has really provided a chilling effect on economic issues in that several LGBTI people are without jobs, and several governments around the world, both here in the region as well as overseas, would conveniently forget LGBTI people from economic protection schemes. So that truly has impacted activism in the sense that we have had to broaden our lens for activism. And so we've been advocating not only for HIV access, not only for HIV prevention and treatment, but also for preventing homelessness, addressing food insecurity, as well as economic issues and poverty issues. I also think that it's important to point out that there's been a lot of social isolation during the COVID pandemic because of the travel restrictions. And so that's also taken a toll on activists' mental health. It's something to keep in mind. We've also not been able to gather together with each other as communities in the ways that we're used to. And so we haven't had a lot of safe spaces for our communities to come together, both at the local level, but also, at an international level. But I think as communities, we have always been innovative and resilient. And so I also congratulate the communities who have really worked hard to find innovative and creative ways to take activism to the virtual world, recognizing that not everybody has access to technology, but we have, continued our activism to be disruptive, to be in virtual spaces, and to continue to make sure that our voices are being heard. I'll stop there, Erica. Thank you.
Thank you, Mohan. Just a short follow-up question. You mentioned that you've had to broaden your lens of activism. Can you share briefly how has that journey been? Has it been difficult? What obstacles have you faced in that broadening?
Yeah, I think the main obstacle is really making sure that it's legible to donors and policymakers, that we cannot view some of these issues with a very narrow lens. And in some ways, I think we've had to center brown and Black communities, the issues of concern to immigrants here in the US, women, including transgender women of color. And so I think we've had to really expand our partnership network to make sure that we're really, speaking on behalf of not just, one community, but really on behalf of a broader range of communities. But I think what's been hard is getting donors and policymakers to recognize that. But that said, I think we've really been privileged to partner with new voices and new organizations. And I think what has been really important is solidarity and unity during this very difficult time.
Thank you very much, Mohan. And yes, we've seen the solidarity and unity of our communities throughout all the pandemics in history, and COVID has not been the exception. So from the US, we move all the way down to Chile. Alessia, what's your experience been? Alessia, you're muted.
I'm muted. Now I'm okay. Well, first of all, thanks for inviting me to this panel. I'm glad to be here. Well, about the difficulties of this pandemic is really broad. I mean, the first to mention is that this crisis has been said that it's democratic crisis because everybody can get the virus, but it's not like that, because even while anybody can get COVID, the truth is that it doesn't affect everybody the same. The most vulnerable communities are really affected the worst. For instance, here in Chile, the first response of the government was to help those who have jobs and have problems in their jobs, or are being fired, or the job had to stop um, their activities because of the COVID pandemic. But most of the LGBT community here, especially the trans community, works outside of the formal job market, and they didn't receive help until months later. So part of the work of the activist community was to help them to find ways to collect help in food or money to help those communities, which ended up without any way of getting an income to survive, because everything was closed. You didn't have authorization to get out to do almost anything. And especially the sex workers were unable to get ways to survive. The community was became very important in this context. Also, the next issue was the priority. We stopped doing the priority. The focus became, well, the health crisis and the economic crisis, and that's okay. But really, the truth is that we have also some needs that we need to cover in the ways that we are affected differently from the crisis, and also things like violence, the lack of safe spaces, uh, violence in our homes, the difficulties to access to health. For instance, most of the HIV coverage and prevention is in networks in the hospitals, and the hospitals were unable to provide that care. I mean, for instance, free condoms. You can get free condoms in hospitals, and most people uh, get those in those spaces. But being closed or being completely unable to attend other priorities than COVID, the access to condoms, to PrEP, pre-exposure prophylaxis, other ways to prevent HIV transmission, for instance, or treatments, became really hard. And well, the other thing was about the visibility, because most of the time, well, now the media is not covering us, not covering our needs, not covering our stories. We are not part of the priority now in that way, and we always had the streets to get out as a community and make visible our demands. But now we can't go out in big numbers. It's not safe for the COVID, but it's also not permitted. So it's been hard to work around those issues. Social media is a possibility. We have worked around that in the best way we can, but it's been really hard in this process. And most of the advances that we're currently in process, like laws against discrimination or those like equal marriage, became a second priority, and it's not uh, are not in advancing in the way we would like.
Thank you very much, Alessia. You mentioned something that really caught my attention. You said we stop being the priority. And we have seen in many countries where some states have taken COVID as an excuse to actually pass laws that affect us negatively, that take away and wipe out our rights. So I want to ask you, do you think that the community stopped being a priority only because of COVID? Was it because of a combination, right, or is it an excuse?
Yeah, you're right. Well, first of all, we have never been the priority. We're part of the priorities in the legislation. For example, we were part taken into account. But the truth is that I think in part it's an excuse. Now the government is a right-leaning government, a conservative government that, well, don't consider a priority the LGBTQ people. So it's in part an excuse, but also it's true that several instances in the society, not only the government, are focusing the priority elsewhere. So in part is a broader problem, because media, for instance, media has always been in some ways allies here, but now, well, the media is covering other stuff. It's not really focusing in our issues, in our fights, in advancing our rights.
Thank you very much, Alessia. And thank you for that input and that experience that you've had, you know, the lack of being to organize socially, physically, in events, in protests, in bringing our voices. I think this is a common factor in many parts of the world. But now let's listen from Elsa, and how has the experience of COVID-19 affected LGBT activism and your work?
Well, just to give you a little bit of context, I live and work in the state of Sonora, which is in northern Mexico. It's pretty far away from Mexico City, which is the capital of Mexico. And when the pandemic hit, the Mexican, sorry, I'm thinking in Spanish, the Mexican LGBTQ Coalition, which has a chapter in Sonora, and many organizations, all the local LGBT organizations are part of that coalition. We were already working on a legislative agenda in addition to all the work that we do in our organizations. So when the pandemic hit, we tried to continue doing that, and we found that yes, while all the problems that my colleagues have mentioned are also true for Sonora and Mexico in terms of the lack of economic opportunities and the restrictions or the restrictions placed by social distancing, and that has had a negative impact on us as a community. On the other hand, I think having been forced to do so many things online gave us new opportunities. So in Sonora, we're usually not able to do a lot of in-person events with people nationally or internationally because we're so far away from the center where everything happens. And now with the pandemic, everyone's getting used to being online, having Zoom meetings. And so for the first time, our Pride Month events were packed, jam-packed, with people from all over the world participating in panels and conferences and doing, helping us do advocacy, which would have been prohibitive if we had to fly them into Sonora. So that's, I think, as Mohan said, we're always as a community faced with being really creative in the face of adversity, and I think that has also been the case. We were also forced to be creative in terms of resolving issues that came from the pandemic. So for example, we had to become an impromptu food bank for a lot of the people who lost their jobs. And so what we ended up doing is making, I forgot how you say convenio, a charter or an agreement with the local food bank so that they had, so that they provided services for people who from the LGBT community who were particularly vulnerable. So yes, just to summarize, I think absolutely the difficulties are there, but also just we're used to being resilient, and I think we're used to being creative in terms of how we resolve the things that come our way. And just in terms of our advocacy platform, I'm happy to report that because of the work that we were able to continue to do, legislation was passed locally so that transgender adults can change their legal identity, which was a big win for us. We're one of the few states in Mexico who have been able to pass that legislation, but we haven't been able to pass marriage equality. And we can go into further detail as the panel moves along about that.
Thank you very much, Elsa. And thank you for all those very positive things coming out amidst a pandemic, you know, all the innovation that has gone through, the hard work. So I thank you very much for all that you're doing. But you mentioned something about the access to food banks, which is something that in many countries, it's impossible for the LGBTI community to access the food banks. How did you achieve this? What kind of work went into that?
Well, I think that one of the things that we've found, and I think this is true all over the world, but when you do that sort of grassroots work with building relationships, I think that, and especially if you're a small community like we are in Hermosillo and in Sonora, it's easier to just, you've established relationships with people who become your friends. And literally what happened was somebody sent us a flyer from a food bank because they were doing special activities around COVID-19. And we said, you know what, there's a lot of, for example, as Alessia said, a lot of transgender people who are out of a job and don't qualify for the support that's being provided by the government. Can we get some food to them? Because they are usually, because of stigma, not willing to put themselves out there and ask for help. So, you know, can we make that bridge? And they said, yes, absolutely. But it was because we had contact on the inside, so to speak. And that, as you know, is part of the work that we do, just building relationships one at a time and just putting in the hard work of training people and giving free trainings. I'm sure you all know about that, you know, and just being available to help people out. And whenever someone needs you, you help them out because you know that in the future they're going to be able to help you. And just building an activist community, I think, is really important beyond the LGBT community and the LGBT organizations.
Thank you very much, Elsa. So essential to build those partnerships, because it always come in handy, to work together in a collaborative way. So from Mexico, we move to the Caribbean. Kenita, how has COVID-19 affected LGBTI activism and your work in the Caribbean?
Thank you so much, Elsa. Erica, it's so good to see you. It has been a while. And to everybody else on the panel, it's really good to be here. I think we have seen multiple layers of the impact. EKID being a sub-regional organization, the impact for us was more to the point of restriction of travel, cancellations of capacity building sessions that would have happened in country. However, the organizations that's under our umbrella, we saw more direct impact on the ground in terms of grassroots, a lot of which has been mentioned already in terms of having to rethink the programs that you are reaching out to people with. There was more a need for food support, shelter support, transportation, medication, that immediate care that says country was about to go in lockdown, and I needed to think about, for those who are HIV positive, infected or affected, and other diseases that they are managing, had to think about medication and what that looks like, especially around diabetes, HIV, and so on and so forth. Then you had the food aspect for persons who might be working daily, weekly, fortnightly, all those different measures of payments had impacts for different people differently. That also had us to look into the way people lived. Not everybody have services at home, like running water and toilets, and some of them were still using community services. And what did that look like when there was actual lockdowns happening? And then you also had the increase in gender-based violence, domestic violence, and how do you respond to that when you are not necessarily in and out of communities? So I think a lot of what has been said again already, in addition to some of those other things, even for parents from the LGBT community thinking about home care with young ones out of school, I think there were a number of issues that we had to think around holistically around our people. And at the same time, also thinking about how did we even start getting ready on top of COVID for a hurricane season when we did not know what to expect. That in itself brought additional layers of stress, seeing the years before we had countries almost wiped out during those seasons. So I think the conversation gives a lot to learn, to realize that realities across different islands were very similar, across different countries were similar in terms of the impact of people. But I think something that stands out for the Caribbean is that really when we looked at the impact of the pandemic, we recognized that a high percentage of individuals actually worked in the tourism industry, and that tourism industry flatlined. And so that gave an additional layer that nobody could have imagined from all aspects of the tourism industry, whether it be hotel, flight, accommodation, those serving small shops that are self-employed but providing services. It went deep, it went hard, and it went fast. Nothing that could have prepared us for that.
Thank you, Kenita. You mentioned the issues and the need around food support, about housing, and many times around the work that we do, we see that it's so difficult sometimes to justify to donors. They need to provide food support, they provide housing, to provide cash transfer. How have you managed to go around that in the Caribbean?
Well, I think we have been fortunate that a few of our donors actually reached out and indicated that we could have repurposed money. That gave us a tremendous help in terms of thinking about not even just food, even communication, just being able to top up somebody's phone so they can make a call to say, I am okay, even if they are not in the best of places. And in addition to repurposing money from our donors, we're also able to launch one of those fundraising activities online, where we're also able to bring in some additional flexible cash that allowed us to transfer to different organizations providing the services on the ground. So that's how we were able to do it.
Thank you very much, Kenita. And I think many of us will be interested to get the list of those donors that are very flexible. So you need to pass us the notes. Of course, you know, this is a virtual meeting, and with COVID-19, all of us have experienced the challenges of conducting virtual sessions. And today is not the exception. We're having some minor technical issues with our panelist, Simon, to join us. So we're going to proceed, and if we are able to resolve the issues, Simon will join us amidst the session, and then we will incorporate his input into the discussion. But for now, let's proceed. And I want to ask all of you very shortly, 2-3 minutes the most, in terms of activism, what things were not done due to the pandemic and what things could have been done despite the pandemic?
Eric, I can go first, and I've really appreciated learning from the comments that my colleagues have made, and they're really quite useful, and I think they resonate with our experience here in the U.S. as well as globally. I think, you know, as Kenita said, you know, we couldn't have been prepared for something like this, and so a lot of what we had planned could not happen as a result of the travel restrictions. And especially as an organization that does global advocacy work, a lot of our work, you know, happens in policy hubs like DC, New York, and Geneva. And in some instances, in some policy fora, it's been really hard to provide, you know, input from a civil society's perspective. In some policy fora, it hasn't really been clear or transparent in terms of how we can weigh in. Including the United Nations High-Level Political Forum. We have the PEPFAR COP season upon us, you know, and we're eager to sort of weigh in on those processes, but it's not still very clear in a virtual world how community input would be meaningfully taken up. And yes, you know, there's been some opportunities, you know, for resource mobilization, but at the same time, you know, as MPACT, we're concerned about, you know, HIV among our communities. And if some donors have actually reprioritized, you know, from HIV to COVID, and which is also, I think, impacting, you know, HIV activism and HIV-related work. And so I think there are some opportunities, but there are also some challenges. Certainly, in some cases, it's been easier to participate because it's as simple as sending out a Zoom link. But I know that everybody in this group understands that, you know, even though we have the virtual technologies, it's hard to do 3-day or 4-day meetings, you know, at a stretch. I just want to point out to one example, Erica, about activism, in that HIV 2020 was initially planned to be one of the largest key population events that was community-led in Mexico City in July, and it did not take place because of the COVID pandemic, but it was moved to the virtual world and ended up reaching, you know, thousands of individuals from around the world. And so it is a success story in that we were able to really move that to the virtual world and succeed in it, because HIV 2020 was an activistic event, in that it was a protest against power. It was a protest against you know, the big AIDS Inc. you know, institutions, and in that, I think we again found the resilience and innovation within our communities through that conference.
Thank you very much for sharing, Mohan, and definitely a lot of things that could have been done differently, but also a lot of very good learning experiences. Elsa, so can you share with us some of those things that were not done because of the pandemic and things that could have been done despite the pandemic?
Well, as we know, any crisis brings to the forefront all the inequalities and pretty much all the things that we're already not doing as well as we could. And in terms of LGBT activism, it turned out, and we've had long discussions about this among my group. It turned out that the people who were able to get on Zoom meetings and have a smartphone and a laptop were the ones who were already doing activism. And so again, a question we ask ourselves all the time is, how do you reach the people who are the base? How do you reach the people who haven't come out of the closet? How do you reach the person that's at high risk for HIV, but that will never come to your clinic or to your event or to get condoms, or to get tested? And we always sort of, cross our fingers that nothing bad will happen, and we'll get to those people eventually, because a lot of us do this work out of the goodness of our hearts and aren't paid for it. We're volunteers. And so I think what we have sort of, the conclusion that we've come to is we gotta up our game in terms of getting more funding, becoming more professional, and really making an effort beyond, social media and the things that we already do, really make an effort to reach the people who are most vulnerable, most at risk, and least likely to be in contact with us right now. I think that's what we weren't doing it anyway, and now it's become clear that when a crisis hits, it becomes even more important.
Thank you, Elsa. And you mentioned that, the first that were participating in activism were those that had the technologies and the digital tools to be able to do so. How do you think we can reach those that don't have those technologies in a situation like the pandemic?
Well, I think it really depends on who you are and who you're working with. But for us, we have access to sort of the educational system, the health system. And I think we need to reach people in the places where they're already at. So schools, health services, rather than do a lot of the things that I know are done in other communities, where you literally go out to colonias, to neighborhoods, and try to do outreach that way. We don't have the capacity to do that here. And so we need to be really strategic in terms of reaching people where they are. So for example, we have an initiative right now that we had kind of put on the back burner that has to do with transgender children and youth. And we really stepping up our games in terms of working with schools and teachers so that they're sensitive to the work that's being done, and so that they become allies and can do that work for us, rather than us trying to go, into neighborhoods and, one-on-one trying to reach all those people. And that's just to give you an example. Same thing with HIV. All this time, we sort of been expecting people to come to our health fairs and come to our clinics and sort of approach us. And I think right now I'm trying to start sort of, it's like a pyramid scheme where you train people to do rapid HIV testing, and then train them to do counseling, so that they become advocates, and they in turn train 5 other people, and those 5 other people train 5 other people, so that it's not just 1 or 2 people in a health clinic trying to reach hundreds of people, but rather everyone in a small way becoming an advocate, becoming a health promoter. Those are the things that we're talking about right now.
Thank you very much. And let's hear from Kenita.
Well, I think one of the things that we definitely did was, I think we transitioned into connecting, because recognizing how some people were in homes not necessarily comfortable, some people were in homes alone and closing off from everybody else. Really, there was a lot of psychological support that was needed at the time. So we actually did a lot of mobile top-ups to leaders, asking them to connect to community. And even ourselves, like the team working remotely, we had to look at how we connect on a daily, so at least the team felt connected, felt motivated, and was still doing the necessary things. Connecting to organizations on a daily seemed like the necessary thing to do, but we also reckon the number of virtual sessions that everybody flooded the platform, and you're pretty much sitting in one location from meeting to meeting to meeting without necessarily taking breaks, especially between March and April, whilst people were trying to figure out how to reroute or reset their programs. And responses to emails were also highly expected. But I think some of the other things that we're able to do was the support systems, really looking at the resilience of the Caribbean and how some persons, some organizations were able to mobilize food support in different ways to get it out to community, being part of the essential services, connecting to government. We were also like monitoring all, which brought another aspect of policy monitoring watchdogs, because at that point, government, the number of SIs, which are the power instruments that were coming out, especially under states of emergency, was one where we had to keep monitoring each one to understand where governments are breaching rights and breaking the rules of their own constitutions, and having to keep reworking that and guiding communities as to where we are and where things needed to happen. But I think the other aspect of what could not have happened, and I think the psychological support, as much as we recognize this was one of the major gaps, where we don't have enough counselors. We don't have sufficient persons who could guide and walk people through some of the much needed help that was needed during this time. So right now, I really hope counselors get a break, because they have been on the clock basically 24/7 for those who gave their services to organizations like ours.
Thank you, Kenita, and thank you for mentioning, that constant need of connecting, the high number of virtual sessions and calls. How have you and the group of activists working in the Caribbean been able to prevent fatigue and burnt out in the community?
Well, for us, that looks at different things. For some activists, being able to serve others actually saves them. And I happen to be one of those persons who believe by not focusing on me and helping others, help me kind of mitigate the stress levels. But with other persons, I also know had to implement like walks or gymming, or some kind of healthy exercising. Just being able to shut down all technology for even if it's half an hour to an hour, and just take a breather. And I know a lot of people did the substituting of food. And so coming out of COVID, I think we have some weight busters that be saying, oh gosh, I can't wear half the clothes I have, I need to go shopping. But I think that different people did different things, even trying to arrange. And I think one of the things that was actually amazing was seeing some people actually exercising together virtually. So even if it was virtual, that exercise aspect actually helped. And I think that a movie, binging on something on Netflix, so these were some of the ways that some people organized. And for me, I went into, where can I find the money? I need money to do things, even during COVID. So I was searching and searching and searching. And I think between January and now, my organization has probably written out roughly about 19-20 grant applications to try to, even if funding is changing, how are we adapting the programs to ensure we still meeting the needs of the people and still doing what we need to do. So not just about EKID, it's about all the organizations that form part of this umbrella.
Thank you very much. So we go to Alessia now, and can you share with us, in terms of activism, What things were not done due to the pandemic, and what things could have been done despite the pandemic? And right after Alessia, we will go with Simon, which we seem to have solved the technical issues. Welcome, Simon.
Welcome, Simon. Well, I think the place where it hits the worst is in health-related issues. I mean, we were about to get the first 90 in the 1990 goal of the ONU AIDS. I mean, 90% of those who live with HIV know they live with HIV, 90% receive treatment, and 90% of those are undetectable and untransmissible. We were about to reach the first goal, the first 90, and everybody thinks we are going back into the numbers because, as I said, this year the treatments, the tests, and the prevention are being lacking in the service because hospitals were collapsed with attending COVID patients, which is reasonable, but it affects this attention of HIV patients. Also, the trans health suffer. There were already long lines to get an endocrinologist or to get hormones treatment or to get an operation, and now it's even worse. All the surgeries were suspended, even for those who had some surgeries that were made in steps. I mean, some people ended up being in an intermediate step between surgeries and are in a really uncomfortable place now in what is about trans health. And well, it's a place where we are pushing to increase the coverage to attend more people, and especially now that we now have a gender identity law and there are more trans people getting out of the closet. That's good, but the tension is getting worse. The activism around equal marriage was hard to make. It was hard to be heard also about those topics. We pushed the agenda with histories of our families in COVID, facing the COVID. I mean, LGBT families, especially lesbian families with their sons and daughters. But it was really hard to make it to the news or to other spaces to show the ways in that, well, for starting, we are families and we are also facing the pandemic. The work inclusion, well, we were making advances in work inclusion for trans people and for LGBT people, advancing with some companies to hire in affirmative action LGBT people, and most companies stop hiring in general, not only LGBTQ plus people, but in general there is a work recession. And also the support groups were an important part for a lot of people. For me, in my case, in my personal experience, especially for trans people, that most in support groups were the first places where we could dress as ourselves, express our identities. And for most people for a lot of people who don't have a safe space at home, they haven't found a way to replace those support groups. And in which places we have made some progress, which space of activism have kind of worked here. One is the inclusion of those who live outside the capital. I mean, before the COVID crisis, the reunions were, physically held. We attend the reunions face to face. So those who live outside the capital weren't part of the discussion most of the time. Now they are participating. And that's really good because, well, it's a diversity of voices and diversity of needs, and also allows them to make the point of all the difficulties, generally the additional difficulties that they face outside Santiago. And the other place we managed to advance is in the anti-discrimination law reform. That one point of communication was that in the worst part of the crisis, in the middle of the panic, there were some cases of discrimination against physicians, against those who held related professions, and that I think ring the bell for some people and managed to connect this with this reform, and we are advancing in this reform also because it affects a broader range of groups not only LGBTQ people, and we have advanced significantly in make the law in a way that not only punishes or emits fines against those who discriminate, but is focused on prevent, on educate, on prevent the damage, not only punish those who damage people.
That's amazing work, Alessia, and thank you for sharing. Simon, now that you're with us, can you share how has COVID-19 pandemic affected LGBTI activism in your country and how it has affected your work? And then also please share a little bit about what things were not done because of the pandemic.
Hello, everyone. I hope you can you hear me?
Yes.
Oh, finally! It's so good to be here. At least in the virtual way, it's so good to see your faces and feel the love across the screen. We hope to see each other soon. I hope. So, going to your questions. Well, my country is deemed as one of the most homophobic countries in the region. It is the only one that has in the whole southern part of the continent that doesn't have any kind of legal recognition of any type of right or a guarantee for LGBTI people. That situation leave us only with policies that are rooted according to the will of the government. It's not. We don't have any kind of policy that is rooted in legislation or long-term policies. So when something like the COVID emergency happens, usually we fall very rapidly to the bottom of the priorities in any area of the action of the state. So in our case, it has a lot of impact in a lot of ways of our work. Most of our work has been providing services, all kind of services in the usual health one, and especially the mental health one are the ones that have been very much affected by the social distancing and the close down and everything that happened. Besides that, well, my country has the largest portion of the population accessing internet via mobile phones. So usually the virtual tools that are rooted in that kind of technology are very helpful, but it comes with a trade-off on privacy. And since the government run every other platform or service through some kind of virtual app within the phone, they access a lot of information that we don't know for sure what are they collecting or why. We only know that a lot of people have been outed. We know that the information of transgender people have been manipulated and used against them to deny them services, to pilot them, even in some cases to since part of the government is it has been taken by the more fundamentalist stream of evangelical people. A lot of groups have been targeting us, activists and other, especially transgender people, via the information that they gather through the official system that the state has in place. So we are in a very dire situation. We are trying to reinvent a lot of the ways that we reach to people, that we gather. We are building our own, virtual tools to communicate, to provide counseling, to distribute ARVs, to link people to our services, and to provide like a filter before they go to the directly to the public system, and we are blocking the intelligence from the government from gathering that information. We are very receiving much pressure about open our files to surveillance, to epidemiological surveillance and cases tracking. That's the excuse, but we don't have any guarantee of how they are using that information. We do have some indications that our government is using private information on the citizens as a weapon. And especially for us in the minorities, it's been very, very challenging to work. So at the same time, we are trying to reinvent a lot of the ways that we are working, and it has come to our attention a lot of the ways that we need to pay attention to how to take care of ourselves and others and our communities in this new scenario. We don't have, we don't know when this is going to end, and even if when it ends, we don't know how much damage they will do, and how much rebuilding that we will have to do. And so we are thinking about that. We are thinking about the after this. How do we get out of this? How do we prevent that they do this again to us? So we have a couple of ideas on that. What was the other part of the question? Sorry.
No, thank you very much. That is very helpful, Simon, and thank you very much for the work you're doing in Paraguay. You mentioned that Paraguay has been frequently labeled as the most homophobic country in Latin America. Do you think that the pandemic has increased or decreased homophobia in Paraguay? And tell us why you think that.
I think in the public sphere has increased a lot of, especially transphobia, not only homophobia. The focus on the aggression of the state and the other public stakeholders, talking about health, talking about social insurance and stuff, has been very targeted towards non-binary people and transgender people especially. We just in the morning we had to witness like an impeachment. To the we have a special secretary for children and adolescents, and that secretary just tried to push a comprehensive policy to prevent abuse and to try to bring some sexual education to the table. And they accused the secretary of pushing the ideología de género, the gender ideology, and they summoned her this morning to the representative chamber, and it was bombarded by religious attacks on implying that they are trying to transgenderize everyone, and depicting non-binary people and gender identity issues as something to be avoided and something that is harmful for children. The whole tales that they share in these campaigns. So it has been relentless, mostly in the public sphere. It's all and everything is rooted in the emergency of the COVID. So they use the emergency as a weapon to be shamelessly transphobic in public, because they are worried for the children and the families, and these people they are trying to destroy it even in this crisis and blah 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 blah. So yeah, they have been a lot of hate in the airwave in the last few months.
Thank you very much, Simon. And it sounds very similar to the reports, to the experiences that we hear from all over the world, states taking the excuse of COVID to further stigmatize us, discriminate us, isolate us. And yet we're still here. I've heard the word resiliency so many times in this panel, but I will go back to that afterwards, because sometimes I cringe when I hear that we still have to be resilient. When will it come the time that we don't have to depend on being resilient to stay alive? I don't want to be resilient. I want to thrive. So we're going to come back to that. And I want to hear all your perspectives. But let's go to Kenita. And you know, Kenita, in the Caribbean can be very different from Latin America in regards to LGBTI rights. How has the progress in advancing equality and Soggy issues been in the Caribbean during the pandemic?
I think that the only thing the pandemic have done is, to some extent, taken some pressure off the focus being on LGBT persons. Whilst it's a good thing, it can also be a bad thing, because, you know, our push or our scream, or according to them, our agenda of ensuring equality is something that's now pushed to the back step, where they say we are now dealing with a pandemic and we're not dealing with LGBT issues right now. But LGBT persons do not stop existing. They don't stop living. And unfortunately, discrimination is twice as much, because you're still seeing where certain access to general public, and yet you get the stereotype, the stigma, the discrimination, and to some extent the violence that may be emotionally or psychologically inflicted, which people don't see, because more often than not, they only look to physical violence. So I think that, like, whilst we are thinking about pushing the umbrella and continuing to advocate, I think the pandemic kind of feels like somewhere back when HIV came around and the focus was totally on the MSMs, and the rest of the persons in the LGBT community was put to a backseat, because, you know, your percentage of risk is different. So this pandemic again has brought another level that we now have to think about how to untwine and not make it another 20 years of feeling like we take 30 steps back. Some of this is being looked at through continued strategic litigation, but also that of education. We still have to continue, because if we look very well, we see some of the policies that are coming about are also taking steps back. So we have to be on the ball. We have to keep on the front foot, pushing, challenging, but more importantly, making sure that we are aware, we are educated, we are keeping abreast of the situation, so that we can actually respond and not be on the back foot.
Thank you, Kenita. And you know, you mentioned education, and I come from Belize, also part of Central America, part of the Caribbean. And always when people talk about education, they think that we have the full responsibility of educating the whole world. What do you say about that?
I believe that if it is not a multi-sectorial approach, if it's not a multi-stakeholder approach, we are still losing the battle, because we have to ensure that the different sections talk to each other. We can do all the media out there, and the media are not necessarily reaching the right people, like the legislators, like the government. Unless you're calling them black and blue in the media, they are not watching. So we still have to make sure that we actually collaborate. But there's also a responsibility on that of private sector to work with us, government to work with us, the media to work with us. We can't do it in isolation. There is no way we can make the strides that we need to make as a people in a nation, as citizens, if all the stakeholders are not coming together and they are not talking to each other. Because I think when you look at education, people tend to think also formal education, but there is informal education, there's sensitization, there's an understanding of what actually peer-to-peer education is even more impressive and more needed than that of formal education. And so we also need to break that word down, education, where people are not misunderstanding when we say it and think that we're trying to teach them, you know, how to be the etiquette. No, We want you to understand. You already have that information, but you need to use it the right way. Practice, you know. You can't be your brother's keeper, or you want your brothers to be your keeper and you can't be their keeper. It can't happen that way.
Thank you very much, Kanita. And it's so enthusiastic, so energizing to hear you all, and all these experiences, but also the great work that everyone is doing. It's 9 p.m. where I am right now, and I feel awake like it's 7 a.m. because your passion really is getting into me. So, Alessia, let's go to you. Chile will soon have a new constitution. What are the risks and opportunities that equality issues for LGBTI community will be addressed, and does the pandemic present a challenge in this work? You're muted. Alessia, you need to unmute yourself.
Now, I'm okay now. Always happens. It happens to me. Before talking about the new constitution, I want to put that in context. In the 70s and 80s, we had in Chile a very violent dictatorship of Augusto Pinochet, and one of his legacies was the constitution that we now have. The constitution has had several reforms in the process. We made them in these reforms a very more viably democratic, in a democracy constitution, but nevertheless, it's a very conservative constitution that the idea of this constitution is to make changes hard. But it makes the quorums to pass a change higher than the average. For instance, here to get gender identity law, we didn't need just 50% plus one in the Congress. We needed in both chambers 4/7 of those who represent us. So it's always harder for the kids. We managed to get more than the 50%, but the kids were not allowed. We were not part of the gender identity law because we didn't make it to 4/7 of the Congress. So the changes of this constitution are a very good possibility for the LGBTQ community. In one part, because this constitution doesn't really protect people. It's not about equality, it's more about property, about some values that are not really the values of this society. We have changed a lot in the latest years. But also, for me, one of the most important places where we can make a change is about equality and non-discrimination, because the constitution we now have talks about the non-discrimination principle only in the space of arbitrariness. I mean, if someone doesn't allow me to get into a restaurant and other people can, that's an arbitrary. It's a discrimination about arbitrariness, but it doesn't count indirect discrimination, structural discrimination, and other ways to discriminate that are not about an arbitrary decision like that, but are about more like policies which are directed in and affect in some ways certain communities, because the requisites that those policies put in place are they proportionally affect some communities. For instance, one of the most recurrent examples of those is in the US, when in the drug war, all the drugs that were used most frequently in the African American community were punished harder than those of that were consumed by the mostly white people. And also in the structural discrimination here, the case that I always talk about is for the trans community. There are a lot of trans women, well, trans people in general, that are being out of the closet for decades. In those decades, they haven't been allowed to be part of the job market. They didn't have formal jobs. So if one of them now tries to get a job in a formal environment, in a regular job where you're paid monthly and you're part of the social protections, they are not going to make it because they don't have a curriculum. They are older in most cases, and they haven't been part of the process of education. There are a lot of trans people that have abandoned the school because of bullying, and we need something else to make it fair for them. I mean, discrimination is already has passed over them. So the possibilities there are, for instance, have affirmative action in capacitation, make them courses to make easier the path to works and make public associations with the private sector, for instance, or like Uruguay or Argentina are make a percentage of some way a trans affirmative action, so the companies have to hire some percentage of trans people.
Alessia,
This
so
is
we will
part of the structural discrimination that is not part of the constitution now, and we want to make it part of the constitution.
we will definitely be looking out for the news coming out from Chile, and we hope that everything goes smoothly and that you are successful. Elsa, you come from a very conservative state in Mexico. In fact, as you mentioned, it's the only border state in northern Mexico that does not recognize same-sex marriage. How has the pandemic interfered with the plans to discuss these issues in the legislative agenda?
Well, as many of my colleagues already mentioned, when COVID becomes the priority, everything else gets relegated, particularly if it's not popular. And as Simon mentioned, I think we've begun to see, now that we're operating more in the virtual world, that propaganda is a problem. And it gets even worse as not just because of the pandemic, but I think it's been getting worse. And so you have all these people who don't understand that the so-called ideología de género, or gender ideology, is a made-up term used to confuse people and turn them against us. And I think a lot of people were surprised because we were able to pass the gender identity law so that trans adults could change their legal name and gender on their official documents, but we haven't been able to pass marriage equality. And I think what that shows is that it's not, I think we need to go beyond looking at issues, LGBTIQ issues, as just, either you're for us or against us. I think in our case, this is an issue of family. And that's how it's been presented to us. I mean, we knew it was going to be an uphill struggle because a lot of people think that we shouldn't be allowed to have families. Because of stigma and discrimination. And I think that if we had tried to include children in the gender identity law, we would have come up against the same kind of sort of resistance more strongly. Because of the pandemic, I think that we have had to kind of change the way we do advocacy. I mean, it used to be just very one-on-one, just show up at people's offices, sort of pester them in person. And now we've turned much more to social media. And it's worked in a way. I think that more and more politicians, more and more legislators keep an eye on social media. And I think it also, the mainstream media also keeps an eye on social media. And so what makes the news on Facebook will also often make the news in the local radio and TV stations. Other than that, I think the issues that we're facing in terms of resistance to equal marriage here is pretty much the same as it was before. And that has to do with the economic and political power that conservatives have in this state. And hopefully we're gonna try to leverage the power that we have that has more to do with social media and has more to do with the work that we're doing with younger people, so that once they get to positions of power, they don't bring with them the same prejudices that older people tend to have.
Thank you very much. And thank you for mentioning, the use of social media, even by politicians. And I think we all know it can be very positive, but it can also be very badly used. The world has seen a very, very prominent example of how a politician can use social media in the very wrong ways. And so I think, we need to take that into consideration and how we use all these platforms. And going about that world example, Mohan, the world recently passed. No, it didn't pass. It literally froze to follow U.S. elections. President-elect Joe Biden soon will be taking office. He has promised to take COVID-19 very seriously, something that is welcome and to hear. But do you think the pandemic might distract Biden's agenda related to LGBT rights, and how?
Thank you, Eric. I think it's a complicated state of affairs. I think with the transition and the election, and I think COVID needs to be top on the presidential agenda for the next 4 years. And I think my view is that that is also an LGBTIQ agenda, in that we need to sort of figure out how to leverage COVID to elevate issues of concern for LGBTI people. So in that, I think we can hope that LGBTI, issues are not sidelined in the context of COVID, but that they're truly integrated in a meaningful way. Certainly, activism has been alive and well in the US, and especially targeting both domestic as well as global policies from the US government, in that advocates have been preparing for a long time for the transition. The Council for Global Equality, that's a network of LGBTI human rights organizations, the Global AIDS Policy Partnership, have all been really working very hard, in collaboration to really influence the policy agenda for the next administration. I think we've seen a lot of hard-won victories rolled back in the recent years, especially for the trans community, but also for the broader LGBTIQ community. And so I think a lot of the work that we have ahead of us has to do with building back some of the successes we've had, and building back some of the gains we've had, but that were rolled back in the last 4 years. And part of that actually has to do with centering Black and Brown communities in activism. And I think intersectionality is another theme that really comes here to mind, in that there's been a crackdown on a whole range of communities, including immigrants, Black and Brown people, women, Muslims, and LGBTQ people. And so I think we need to really stand together to really advocate for our rights, including sex workers and drug users. And so I have some hope and optimism, but I also know that we have a lot of work to do ahead of us.
Definitely a lot of work, but the whole world is watching. The whole world is watching and following and hopeful. It's very hopeful. So we hope to hear great news and very positive news soon coming from the US. As many times, politics and decisions in the US affect the world. We all know that. But, I want to go back to the comment I meant about resiliency onwards, because it really tires me that people expect me to be resilient. I remember my grandmother used to tell me, whatever does not kill you makes you stronger. I wish she was alive and I can tell her, I don't want to be stronger anymore. I just want to enjoy life. So I want to hear your thoughts about this. What do you think that needs to be done so that we don't have to depend on being resilient anymore? Anyone?
Yeah, I want to start.
Okay.
I want to start. You are absolutely right. And I think I can speak for myself, but I'm sure it'll be the same for everyone else. We so often mention resiliency just because there are so many people out there who don't think they're strong enough, and who are just on the verge of giving up, and we don't want them to give up. So I think that as long as that's the case, we're still going to have to mention the word, if not the word, the concept. That being said, I agree with you completely, Erika. And I think going back to something Mohan said right now, I think those of us who are privileged enough to be in spaces where we can make a difference have to really think about what we can do to make the world better for people who are just trying to survive right now. I'm very privileged in that I kept my job and I can work from home, etc. And so what am I going to do with that privilege? And I think intersectionality, as Mohan said, is very important. Those of us who have access to resources, I think, are obliged, or I think that's something my grandmother and my parents taught me, is that you were blessed with all these privileges and now you have to use them to do good. And I think that needs to become contagious and have other people be inspired by the work that we do so that they're willing to do it too.
Thank you very much for those words. And that's very true. The wisdom of our ancestors are still with us. Anybody else wants to add anything before we...
I mean, there's just so much that have been passed on to us. And I think there are high expectations. One, we place on ourselves in terms of what we expect to do, what we'd like to do, what we'd like to achieve, where we need to go next. And then there is the other aspect that comes with the territory of the job. And sometimes it's not even the job, it's you being in the wrong, right place at a certain point in time in your life. And I say wrong, right place because when you think about resilience, you think about always having to be the big person, always having to say the right things, you almost always have to have a sense of how to direct people, even when the situation is not yours and it has just been thrown up at you. And thinking outside that box, giving that direction, being able to say yes. And sometimes, being resilient also requires you to say no, also requires you to take a break and not feel guilty about it. But how many of us on this panel could say that we actually take a break and not feel guilty of all the emails we have to respond or somebody needing our help and we're like, should I sit down and watch this TV or eat this burger or do I get up and go? So we are constantly being put in those positions and also being judged at it by the very same community that we serve with it. So I think that when we look at our activism, it's a point of selflessness, but also selfishness, because we want to create an atmosphere, like you said, Erica, where we don't have to be resilient, where we can live, where we can be. But to get there, we have to put all that mileage and all that work. And like they say, activism is the rent that we pay for being in this world. So I do not know at which point it stops.
Thank you very much, Elsa and Kenita, for that. And Mohan, I want to turn to you really quickly, and if you can provide some short input about, with all this isolation, the need of human contact is so big already in our communities that we are chased out of our homes by our families, rejected by society, discriminated by the state. Practically in some of our countries, we don't exist. How do we deal with that? And it's related to the mental health question. How do we address this issue?
Yeah, it's a tough one, and I think Elsa and Kenita really said it well in that superheroes also need a break once in a while, and it's inspiring to hear about grandmothers, because my grandmother was also inspiring in that way. She never took a break. But I think, it's really important. I think self-care is something that, has been on my mind a lot these days. And we talked about it as a team yesterday, within the organization. And I think one reframe for the word resilience is reliance, in that I think we have to know that other people will hold our back when we fall, and that sometimes it's okay for you to take a break and somebody else will run for you, right? And so I think we have to really lean into each other and figure out who those supporters are and who those, our community is, who those folks are, and I think we can also plan it in a certain way that it happens. But I think there's enough energy and enthusiasm and activism in the world that I'm confident and optimistic that if I fall, somebody will hold my back. And so with that, I think self-care is really quite critical.
Definitely, Mohan, and thank you for reminding us of self-care. So as we approach the final leg of our panel, I want to address one question for all of you and provide short answers, 2 minutes or less. What changes in LGBTI activism do you think are here to stay, and why? Let's start with Simon.
Thank you. I think that our sense of community is, as Mohan pointed out, uh, very good, very well. I think we all collectively realize that we have only each other, and that kind of realization, I think, is here to stay. Our fragility has has transformed us I think collectively in a more humane way. I think we look forward to that contact, that unity, to that belonging sense that we take it for granted. And I think that this reinvigorate that. And the other thing that I think is here to stay is these holistic looks that we are giving to things now, to our actions, to think about the transcendence of it all. Since it's already so little time for us, I think that that the way that we use our energy and the way we use our impulse to make this world a better place are gonna be laser focused on what we need to achieve. And I need to address your previous question. I think that we already have the answer to the question, when we can celebrate ourselves, when we can just forget about having to go there again, to having to go to our resilience again. And I think that one way that we can move forward that concept is to look at the care and to look at the reparation that we need. We need to acknowledge that there has been an ancestral damage to our own to our whole culture, and we need to make that damage go away. We need to repair it, and the only way to repair it is openly discuss it, and that brings with it openly talking about race, openly talk about gender, or openly talk about racism and slavery and the reparations that come with that discussion.
Thank you, Simon.
Thank you.
Thank you. Elsa?
Yeah, I agree with everything Simon said. And I think one of the changes that we're seeing with the pandemic is more of a focus on inclusion. And what does that mean? And how do you actually have it so that it's not just a word you say and, try to get all your LGBTQIQ plus letters in there. But what does it mean? So for example, historically here in my region, trans men and women and non-binary people have sort of been relegated because they were focused on surviving. And so what does it mean for those of us who are cisgender to promote their leadership in a way that's empowering and not just exploitative or not just in name only? So I think the concept of inclusion is very much ours, and I think it's been I think it has energized a lot of movement, not just ours. But I think we run the risk of having it be sort of co-opted if we're not really clear about what it means and how we get there, how we become inclusive.
Thank you very much, Elsa. Alessia?
Now, I think we have learned some tools like using the technology to reach to more people, and also we have learned to teach other people to use those tools to communicate everything we need to communicate in these ways. Probably we all already use the social media, but now we are probably using it better. We have also included people which are not in the region or necessarily so close to participate in spaces where they weren't invited or were harder for them to participate. But I think the first and most important change is the focus on the vulnerability. This crisis has made us face that we are even more vulnerable than we think we were. So we have to fight in a stronger way to face that, to change that, and to make the community not only resilient but to have the resources to face a crisis like this without such levels of sacrifice and suffering.
Thank you very much, Mohan.
Thank you, Erica. I think I'll have to just say the same things that everybody has said in a different way. But, I actually hope that technology, as much as I appreciate that we've learned a new way of working, I really hope that that doesn't stay, that we actually can meet together and be in person and hold each other. But I think, just like my colleague said, I think community collectivism is something that comes to mind, in that I think, if anything, COVID revealed to us, it's that we as a community care about each other, not only about ourselves, and we also care about the world. And so I think with that, I think hope and optimism are here to stay.
Thank you very much, Mohan. It's been a pleasure to be with all of you today. Here we have you, Kenita. You're back just in time. So tell us, what changes in LGBTI activism do you think are here to stay, and why?
Well, I think something that's definitely here to stay is the denial of politicians to say LGBT persons exist in the country. That is something that can no longer be an scapegoat for not necessarily having legislation or not recognition in a constitution of LGBT persons. Because we're certainly visible, we're certainly present, we're certainly at the table, and it's one that allows.
Apologies for that. We seem to be having some technical issues. But it's been a great panel with great conversations. We have talked about resiliency, about the superheroes in all of us, in all our community. But let's recognize that superheroes also need a break. We have talked about our fragility and how that has transformed us. The wisdom of our grandparents, of our ancestors, being in the spotlights, the advantages and disadvantages that comes with that. We definitely need to make a better place, but we are already doing that. So let's build on that. And the importance of mental health and the emphasis we need to have in inclusion. Mohan, Kenita, Simone, Alessia, Elsa, it has been a privilege and honor and a huge learning experience to be with all of you here today. And I want to remind all our viewers that right after this panel, we are having a keynote conversation titled, "Are Lessons Learned from the HIV Pandemic Applicable Now?" This will be between Stephen Lewis, co-founder and co-director of AIDS-Free World, and Terry Ford, the chief of Global Advocacy and Policy AIDS Healthcare Foundation. Please join us at 3:45 p.m. Eastern Time and on this important discussion. We really appreciate all your time and very, very much the effort and the wisdom and the experience, passion, and all those words that came from deep in the heart of all our panelists. Thank you very much and good day.